Okay, we can get started now. Hope everyone having a good week. Let's see, let me share my screen. Okay. So let's see what we got here. We don't have that many questions this time, but so it should go very fast. Joe, I'm TH1, TH2, TH17, COMT, MAO, and MTHFR++. I have read over and over again your sites trying to modulate all this. I've consulted with these several times. Thoughts on hyperbaric and what supplements could I try? So TBI, traumatic brain injury, EBV, Epstein-Barr virus, CMS, and mold. Okay. Back surgery activated my Th2 as it does, and stress. Okay. High cortisol, low ADH, low VEGF. So let's see what is the question. Thoughts on hyperbaric and what supplements I could try. Hyperbaric, I think, is a great treatment for the issues that you're dealing with, and that includes TBI, infections, and mold. So, and also it's good for Th2 dominance as well. It is good for low VEGF, and I don't know how it would interact with your genes per se, but with your immune system in general, it seems like it's a good fit. Should I retest my C4A and TGF-beta-1 levels again? They were 21,200 and 8,500 last year in September, respectively. My doctor never had me follow a protocol to remove toxins from my body. Would I still be toxic from mold exposure 1 year later? Should I have more in-depth testing done? Thank you. So the question is, your inflammatory markers are high. You can be, you still can have an issue from mold 1 year later, correct. It could take a lot of time to detox from mold. It all depends on how long you were exposed to it. So, you know, if you were exposed to it chronically, it does make its way in the fat tissue, and then it could take a long time, you know, until things recycle or get detoxed. So, you know, if you got sensitized to it at some point, you could be reacting to it. I mean, there are tests to measure mycotoxins, but it doesn't necessarily have to be from mold. It could be from other toxins. And yeah, I think detoxing in general is a good idea. And the best way to detox is you should start from trying to be outside in a clean environment for as long as possible. And yeah, like not a big city, especially big cities in California. And then you can try other approaches like, you know, various kinds of supplements for detoxing and things like that. Okay. How do you use ISIS? What are your preferred settings for sleep and addressing brain inflammation? This is this is a big question. Everyone's different. I don't think the settings are as important as just putting it on. I wouldn't use it for sleep, personally. Brain inflammation, yes, but not sleep. And yeah, I just use like a high-powered setting, but that's something that you can actually email Dr. Dennis and he might respond. Or yeah, let's see. The best way, though, honestly, one of the problems with ISIS is that people sometimes don't have a way to measure the results. But if you're using it for your brain, if it's for pain, more like if it's for bone healing, that's very clear that there's a lot of research that it heals the bone. For other conditions, it's not so clear. But, I think it's possible to be used for brain inflammation. I wouldn't use it for sleep. If you're using it for brain inflammation, then I would just try out different settings and use a brain gauge device in order to you could read about brain gauge on Self-Hacked. I would read about that in order to measure your results, because otherwise, if it's to do with brain inflammation, there's subtle changes that are hard to realize subjectively. So honestly, I would go with a trial and error approach. Credible experts say two things in my experience. If you want to get the best benefit out of lab tests, do what you always do. In other words, take your supplements and eat normally up until the night before the fasted blood test. Yes, I agree with that. The other thing I see is just the opposite. For example, Caroline Dean, MD, ND, says not to take magnesium for a few days before the test to avoid an elevated reading. What is your advice? I would go with the former. Do what you always do, because you want to see what you want to change. If you're testing magnesium and you're taking a magnesium supplement, you're probably not going to be deficient in magnesium. So yeah, if for magnesium deficiency in particular, I'm not sure. Maybe if you want to get off a supplement, then that's a different question. So depends what your goal is. If you say I want to get off of magnesium, then try it when you're off of it. But if you're, but otherwise, just do what you normally do and see what your results are, and then you can see what you need to change. Using Lab Test Analyzer for my results, I realized that I needed to include a lot more olive oil in my diet, and that's what I started doing because my LDL cholesterol was high. And again, it's hard to know it's going to be high. I was consuming a lot of ghee, and ghee is a saturated fat, and saturated fats do increase LDL cholesterol. Now, there's research that shows higher LDL cholesterol is not very good. But some people it doesn't really influence much, like LDL cholesterol. So it's something that you need to test and see. And for me, it did influence it a lot. So I just switched my fats mainly to olive oil and sometimes ghee, but mainly olive oil. And it's made a big difference. So there's other changes that I've done just plugging my results into Lab Test Analyzer. So yeah, I definitely would recommend using the program labtestanalyzer.com. You probably know about it because I've spoken about it a bunch before, but and that's probably why you're asking me about this. But yeah, I think there could be good advice on what to change. Why don't use ISIS for sleep? I have found that it increases wakefulness, so I don't know why it would. I don't think it would make you more tired. Ooh, oopsie. I by mistake hit a question. I can't see it now. Okay. Hi, Joe. Do you still recommend methylene blue as a nootropic? Yeah, I do. I liked your article about methylene blue, although it is 5 years old. Here's a study about potential CNS poisoning. Yeah, I'm assuming that's in large doses. I definitely would not take it in large doses. This is going to be in the milligram. I'm in favor of a microdose. You see, 5 to 10 milligrams per kilogram. That's massive. Or 7.5 to 10. I mean, that's a very toxic dose. We're talking about in total like 100 micrograms for someone who's 65 kilos or something. I think I'm 68 kilos. And I'm saying it in kilograms. I'm about 170 pounds. This is per kilogram. Yeah. For me, I mean, this would obviously be a massive dose. We're talking about a very, very different dose. The difference would be like, drinking 10 shots a day of alcohol versus, a few drops in your mouth of alcohol. Very different effects. Well, I'm not saying I don't know of any use for that, but it's just very different. But yeah, I still recommend. I still think it's good. For me personally, I don't use it right now, but I think it's a good hack. Again, I do a lot of different stuff, so when the reason I don't use it is because it's not a pill. It's not like I could just take it as part of my supplement routine. I have to use a drop, and that's annoying. Hi, Joe. I was thinking about trying LDN, low dose naltrexone, to help with my issues of chronic fatigue and brain fog. Do you think this would help? It's one of those things that it helps some people and it doesn't help a lot of people. It's something that you can try out. Some people it can make worse, but it's a treatment that could potentially help you, but I would give it a 1 in 15 chance of helping you. Now, if you think that's a good chance, then I would take it, which I think, a lot of these supplements or medications don't have very high odds, but you try enough of them that don't have a lot of side effects like LDN, it's a good strategy. Hi, Joe. I've mentioned my issues numerous times here now, so I won't repeat them. Basically, I deal with pretty much constant low energy and brain issues. You replied to some of my other questions that you think this might be related to limbic system dysfunction. That's for sure. I think that. So my question is, what are your top recommendations for healing, improving the function of the limbic system along with the hypothalamus? Do you think repairing the myelin sheath is something I should look into? That's a good question. I don't think it's because of the myelin sheath, but I think a lot of the treatments, we have a list of things that increase myelin sheath, and a lot of those things would be helpful, I think. Mainly, some of the big things that I think can help repair the limbic system is, meditation and yoga. Those are one kind of thing. Neurofeedback is a good thing that can fix the limbic system. Cold therapy, like ice baths, is something that could fix the limbic system. Sun, getting good amount of sun. If your limbic system is broken because of food or toxins, you got to change your diet to a lectin avoidance diet and live in a cleaner place. So it depends on what it is. Circadian rhythm entrainment. So getting into good light cycles and sleep cycles and getting enough sleep. These are very big for the limbic system. So people with limbic system issues really do not respond well to very little sleep because sleep really destroys your limbic system. I mean, lack of sleep. So sleep, a lot of the very healthy behaviors that I recommend: sleep, sun, um, cold baths or cold ice baths or cold showers. I think those are good. Things like that. And again, if you have a diet issue or toxin issue, you need to fix that. That's just going to be a chronic thing. But some of these behaviors that I'm mentioning will go ways into fixing that. Sometimes medications can help fix it. Depends, um, what the issue is exactly. But that would be more of a last resort treatment for me, if all else failed. Okay, so those are all the questions. Thank you, everyone. And if anyone has more questions, I can answer them. No one? Okay. All right. So it was nice taking your questions, and have a wonderful weekend. Okay. Take care.